Welcome to the course. I think you'll find the course very interesting as well as very adaptable to your occupational lives. My name is Dr. David Milan, and I will be your professor for this semester. Throughout the course of the semester, we'll be looking at various agencies as well as different types of case studies concerning disasters, rioting, and the advent of Ebola. This course will not only allow you to have an academic approach to response and crisis management, but it will also allow you to utilize your skills and critical thinking in regards to developing an incident command plan as well as being able to utilize general staffing for such events. Let's get started by taking a look at two events in dealing with both natural and biological hazards that impacted us in North America. First, what I would like to mention is Hurricane Katrina in 2005. As we all know, Hurricane Katrina struck in August 2005 in Louisiana. The damage and devastation that took place with this catastrophe probably could not be imagined. Even with the advancement in technology, the use of radar, early warning systems, it probably was unthinkable of the types of destruction and life loss that would occur with this catastrophe. As the events unfolded, we can see the need for additional planning, alternative care sites, and also using more medical facilities. Due to the catastrophe and the flooding and the advent of the communication failure, there were so many antennas and power areas that were rendered useless, many of the hospitals were not able to perform their functions. Understanding any type of communication failure, you need to be prepared, and best practices need to be ensured that communications do not fail and the stability within this area can remain at a normal pace. Training and education are at the forefront of being able to mitigate circumstances that may arise during any emergency, disaster, or catastrophe such as Hurricane Katrina. During a catastrophic event such as Katrina, a multi-tiered response approach is needed in order to address the issues of life safety, media-related issues, as well as being transparent with all the community members and stakeholders. Those that are residing within the disaster-stricken areas, in the case of Katrina, are in need of transparency. The incident command and general staff were confronted with several issues. When the main issues were confronting the command structure, there was much communication failure as well as disarray. In order to handle this disarray, personnel needed to be called. However, one issue that was occurring was that many personnel were leaving their posts. It is said that approximately 33% of all personnel that are working within an agency or a public entity will eventually leave their posts to tend to their family members, loved ones, or even their pets. Let's turn to the actual event now. In accordance with the Emergency Assistance and Disaster Act within the Louisiana office at the time, the governor was able to establish provisions that were needed for this event. When the hurricane was approaching, unfortunately, the majority of the evacuation routes were jammed with vehicles, other responding agencies, as well as trucks that were competing for space on the highways. Unfortunately, due to the amount of traffic, many of the autos were abandoned and left closures in many of the lanes and the highway systems. Looking further at the disaster assistance plan, in the event that all the resources were used up immediately, there were mutual aid agreements that were established. Congress back in 1996 also established these mutual aid agreements in the form of temporary shelters, cargo aircraft, helicopters, and National Guard troops if necessary. Despite the fact that there seemed to be limited places that both the state and federal levels were able to comply, this seamless framework appeared that it was going to be tested due to the magnitude of the storm. It was difficult to maintain transportation and communication within the public works area. During this time, although there was adequate warning with regards to the type of storm Katrina was going to become, there was still a lack of preparedness both on the civilian side as well as the government side in this response. Several of the warning signs were not acknowledged by the leadership, and in some instances, perhaps much of the evacuation in several areas were not heeded. They were directly impacted by the storm and prior to the storm's arrival. The branches in the military service didn't prepare for helping out and ready to supply the area located near the Superdome, as well as the state shelters. It would also be assisting in law enforcement and traffic control that were needed around the area. Once the mandatory evacuation order was given, there was still the issue of those who refused to leave and did not believe that the storm would impact them greatly. Oftentimes, many of the areas were forgotten about during the course of the emergency and dealing with special needs populations, for example. These populations with special needs include the elderly, pediatrics, as well as those with language barriers. All of these need to be included in any type of disaster plan. Once the storm did reach land, for one of the many issues that they were facing was dealing with the breaching of the levees. Within the storm's sustained winds that were 190 miles an hour, there was very little hope that the levees would not break due to the sustained winds. Many of the hospitals that were able to provide services were eventually rendered useless within hours due to the fact of the storm's magnitude, as well as the flooding that was occurring so rapidly. Although the storm hit as fiercely as it did, usually once it does reach landfall, it does diminish. On the other hand, there were still tens of thousands that were not evacuated from the flooded areas during the crisis. Keeping this in mind, it is necessary for communication systems to be activated. Once the storm had damaged several towers and cell towers, this had rendered the city's communication system useless. Once the communication system had fallen, there was still a greater chance that more casualties, more issues, as well as the levees failing, contributing to all parts of this scenario, making things impossible to manage. Although there were many rescue teams for thousands of people, there were still thousands of people that were stranded. Over 80% of the city within Louisiana was flooded, and there was very little room to move medical supplies as well as food and water. Thus, the crisis becomes out of control due to the many areas where personnel had left their posts in order to attend to their families. It was also due to the lawlessness within the city. Further medical emergencies were arising, and the crowds were continuing to grow in anger due to the angst and anguish that was occurring due to lack of federal assistance. The federal assistance appeared to be lacking, and the responsiveness was not quick enough. There's not much that could be done to stop the falling of the dominoes in this instance. Unfortunately, the lack of communication, the reports that were going on, and New Orleans oftentimes became skewed on the map. Eventually, the Department of Defense was called in to step in to perform some of the logistics and helping with the response. Unfortunately, it took several days for National Guard's troops, supplies, and other personnel to arrive in an organized manner in order to assist those in need. Unfortunately, due to the magnitude of the storm, the death toll was shocking, as well as some of the incidents that were taking place. Rescue operations were currently underway and personnel were arriving daily, but there was still also the challenge of rebuilding in order to construct New Orleans after such a catastrophic event had taken place. Let's turn to SARS. In turning to SARS, this may also be compared to Hurricane Katrina, but in a different capacity as this is a public health event. Some of the questions we do have to ask are regarding some of the challenges in the tasks for responders that are involved in what to look for in what types of places in this instance for public health. The emergence of SARS came in Toronto through a commercial airliner from Hong Kong. And at this time, this type of virus was mysterious and unknown. Eventually, this virus would be spread into hospitals, impacting hospital workers who treated these patients, and therefore they had very little time to prepare for such an event. Due to the fact that this was new and first time in Toronto, the virus found its way into many areas of the hospital, confronting hospital personnel and looking for medical assistance immediately. Their location to patients in the emergency room, as well as figuring out what type of virus this was, at a further glance appears that it might have been pneumonia. But there were also some thoughts that it might have been related to tuberculosis as well. Eventually, the World Health Organization created a global alert in regards to the outbreak that appeared to be typical pneumonia that was commonly found in Hong Kong and Vietnam. However, after a few days of testing, research, and other examinations that was determined by the World Health Organization, it was determined that this was SARS. The World Health Organization then indicated that this would be a global pandemic and a global alert based on the seriousness of this illness. Where the main issues were now confronting the hospitals was dealing with the number of patients that came in contact with those who were infected with SARS. The hospital workers that also came in contact with those patients, and how to maintain isolation and quarantine those people who were already left the hospital were some of the issues that were confronting health specialists. There was a dire need at this point to make someone in charge of the incident overall. Specialists and other groups that worked in countless hours behind the scenes in order to put together a strong document regarding mandatory procedures and precautionary measures regarding infection control were established for both hospital personnel and visitors that were entering into the hospital. Eventually, every hospital was to create a SARS unit within their own area, and personnel were asked to take special precautions in regards to wearing gloves, gowns, and other protective eyewear and face shields in order to minimize the exposure to SARS. Unfortunately, some of the measures that were taken were not true to form due to the lack of data and research that was being done in such a short time frame. Thus, there were many directives that were appearing overly long, and they were complicated and did not appear to be needed in such an emergency. Through the use of isolation measures, quarantine, and proper hygiene, as well as performing screening through Toronto's International Airport, it appeared to be able to handle the issues and the situations that were presenting themselves. There was a combination of political pressure, the fear of the unknown, and the public outcry in demanding information in regards to SARS. As well as working alongside the World Health Organization and maintaining the standards, it was apparent that after the first outbreak, the public wanted to know more information. But the lack of information was self-evident due to the fact that there was relatively new virus and research was being done so quickly. Again, much like with Katrina, this event showed there was a lack of communication, lack of resources, as well as a lack of coordination up front in order to address this issue.